Okay, good morning and welcome to my worst nightmare. So, I'm on my way to a holistic dentist. It's a biological dentist near us. Near us. They're never that close. But I wanted to take you guys along and share a little bit about my journey of getting the amalgam filling removed. So, I already had it removed. I had it removed 5 years ago. But what's happened since then is stuff that I think people don't really talk about. And just give you like an update what this type of dentist does. How do you find this type of dentist? Because when you're trying to heal chronic symptoms, I think it's really important to address your dental health. Oftentimes that can be at the root of a lot of chronic infections and chronic systemic issues throughout the body because of how your teeth connect to other areas of your body. So I, yes, I had a cavity on one of my molars back here when I was in probably like fifth grade. Like I was really young. And they went ahead and put in an amalgam filling. That was the only one that I had. And it was cheaper at the time. I remember people saying it was always better to get the white ones, but nobody really knew the harms of the metal fillings up until recently. I think there's been a lot of research on it and how it can be leading to like autoimmune conditions. The mercury in them, it's about 50% mercury, and it can be a neurotoxin causing Alzheimer's, dementia, whatnot. So I knew when I learned about that stuff that I would want to get it out. But what people don't realize is that after you get them out, the tooth can be so weak that it is more prone to cracking. And I actually think I cracked it on something that I ate at one point, and it's just more susceptible to that. So I went in 2 years ago now, and they told me that there's a small little crack and that I should get it dealt with. And then I had this little guy, and so I didn't get it dealt with. And now what they found is that there's a little bit of decay behind that filling, that replacement filling, the white one that's there right now. And yeah, I think a lot of holistic practitioners or holistic dentists are gonna a lot of the conventional dentists will recommend right away a crown. And this dentist, for a lot of reasons, doesn't really believe in doing crowns. She'll always try to preserve as much of the tooth as possible and find yourself one of those. But you really want someone who's conservative. So when I was originally getting diagnosed with this, even the holistic people were telling me that I needed to get a crown. And I went digging and looking and got a bunch of second opinions from holistic dentists that were all around. I probably found every single one in the state. And I landed on this one that I feel really comfortable with, that I really like. And basically what she's going to do is it's not technically considered a crown. It's an onlay. It's basically patching it, but you do have to go through and replace the filling. And some people call it a partial crown, but she's basically just trying to preserve as much of the tooth as possible because we don't want to get to the point of needing a root canal. And if you don't know about that, you can just go and do a little bit of digging. Root canals are not great for a lot of different things in your body. Once you drill into your jawbone, there could be a lot of risk of infection, and it does stimulate nerves in a different way throughout your body. I have a lot of dental trauma because I got a lot of fillings done as a kid before I had good nutrition that were done without anesthetics. And it was my choice, but I did not like Novocaine. So I would get these fillings done without any anesthetic. And let me tell you guys, it did not feel good. And so I got a lot of anxiety when I go into this. Practitioner is really big on making sure that there's no norepinephrine inside of the, oh my gosh, I just said it, the shot, the Novocaine. So no norepinephrine inside the Novocaine shot that they give you to numb the area, because the norepinephrine can actually cause more anxiety, things I'm learning. So she gives CBD to her clients to calm them down. She says it works. I don't believe it, but we're getting it done anyway. And the cool thing about this place is I will actually show some footage because I did a consultation with them initially, and they actually will take a slide of your mouth bacteria and just to determine what type of cleaning you need. So if you have really like a lot of pathogenic bacteria in your mouth, they will like prescribe a different type of cleaning versus if you have more balanced ecosystem in your mouth, then they would prescribe a different cleaning. So I had very minimal, probably because of all the gut work that I do. I think I showed up there drinking a keeper smoothie. And so there was a lot of balance. And the cool thing was she showed me, so that's why I'm going to show you here. She actually showed me what it looks like on a very vintage TV that you probably won't be able to see all of it because it was actually kind of hard to film. But she was pointing out what these different things meant and basically showing that there's not a lot of pathogenic activity in my mouth. They're very minimal, and minimal is normal. Like we know with the gut microbiome, you're going to have some pathogens. It's actually not a bad thing to have pathogens. It's really comes down to the makeup of them, but it does influence a lot of different things. And she's convinced that the biggest reason people get cavities actually has to do with blood sugar. And when your blood sugar gets destabilized, your blood is sugary. That's actually what causes the cavities, and also mineral depletion in the diet. But if you want a good book, there's a book called Cure Tooth Decay that I will have linked below. And I'll also link my resource on finding a holistic dentist, because I take you through like a check mark, like a check sheet on all the things that I look for, the things that I try to find when I'm looking for one. And you guys, I've done so much digging. I found just so many different holistic dentists, ones that claim to be holistic, ones that are not really holistic. And it really matters it just really matters for the way that they handle your teeth. So I'll leave that link below. But for now, you can enjoy my husband picking his eye. I'm going to take you along and show you the office. I don't know how much they're going to let me show you, but I'll tell you about my experience at the very least. And she's going to give me some homeopathic things to take home. I just like her approach. I think it's really good. I think it's really crunchy, for lack of a better term. But I'm always looking for the most natural options and the most biocompatible options. And she's seems to be really great at that. So show you what I find. Hey, buddy. You coming along? Coming for the ride? Somebody's got to drive me home. I will actually say I probably could drive myself home if I didn't want to. And I've never taken CBD. Obviously, it's probably not going to impair my driving. It's supposed to just be anti-anxiety. But the big debate here was that I was trying to find a biological dentist, which is not going to happen. It's not going to happen. I was trying to find one that did laughing gas, which I know is is like a neurotoxin, and you're not supposed to do that type of stuff if you're really trying to be natural. But that's like the only thing that would calm me down. That's the only time I've ever had dental work done that I felt moderately at peace was when I had the laughing gas, the nitric oxide. Was looking for someone who would do it, but she does other things instead, and she does replace it. And that's where the CBD comes in. So obviously I'm not going to be like under the influence. Like I probably could drive. I'm not having laughing gas, but I don't want to. So I have my support here. Okay, we're here. I'm not going to show like all the information in this. If you live in Chicagoland and you want like details of this, you can email me through the link in my bio. But this place is great. And I do also just want to say that I'm not a delinquent when it comes to my teeth. Like the reason this decay is happening really was because of the crack and all the wear that has gone on with it. It's formed these like unnatural shapes and pockets in my tooth that are just much more prone to decay. But that being said, I was told by Dr. Becky Plotner to oil pull up to 17 times a day to try to remineralize the tooth. I did not ever do that, so I have no data on that. But I do take pretty good care of my teeth. I make my own toothpaste. It's all like remineralized toothpaste, remineralizing toothpaste, and a brush, and I floss pretty religiously. So I don't end up with tons of cavities besides this, but this issue is really amalgam related. So I'll show you what I find.
Okay, they just numbed me and I didn't feel a thing, you guys. That was crazy. She did CBD under my tongue and then a gel, and then she did the Novocaine, but I didn't even feel it. It was literally just like vibrations. It was very good. She's good at what she does.
Physical impression and then send it out to a lab. They would scan it into their computer. So this will be carved out of a ceramic block. Read your Wow. And then just cemented on like a piece.
Wow. Is it literally made? Where is it? Is the machine out there?
We have in our little lab in the back.
Cool.
So we take that first image just like a copy, and then we overlay the two, so your bite will be fitting just the same. Gosh, so just minimal adjustments in the mouth.
You did. Technology. Okay, I got it out. Hey, can't really move. They're gonna put it back in. Okay, so all is done. They are as crunchy as it gets, you guys. She's pretty anti-toothpaste, in case you're wondering. A little bit of toothpaste, low ingredients. She doesn't even use toothpaste. She thinks it's a scam. So she's my type of people. If you can see, this side of my face is a little numb, but the procedure went well. And I have a partial crown onlay type thing on that tooth that had a little bit of decay after getting a filling to replace my amalgam filling. So that was like 5 years ago. And that amalgam filling really was very deep and very damaging to the tooth. But then the guy who put something on top of it put just a plastic filling, and she was saying that's not ideal. So hopefully you can hear me. All of this said and done, she thinks that for an instance like mine, porcelain would be better. Very interesting, though. She's really smart and she's very knowledgeable in all things like homeopathic. So if you can find yourself a biological dentist to help you, find one to actually get it removed. I found a holistic dentist to get my amalgam filling was removed, but ideally they're biological. That's what I'm learning. Okay, so I will show you some footage of like the whole experience. But if you're having trouble finding a biological dentist, I will leave my checklist, my biological holistic dentist sourcing checklist, so that you can find one yourself and know exactly what to look for and the questions that you need to ask, because it is complicated, you guys. And if you're joining the blueprint, then you get a safe amalgam removal guide. So not just the holistic dentist sourcing guide, but all things to know about amalgam removal, mercury removal. We want to get the toxic mercury out of your mouth, but you want to do it safely, and then how to chelate mercury after the fact so that the mercury doesn't cause any problems. It's very likely. Often they do a very good job if they're certified safe. SAFE, that's a certification. But then you do have to clean up the body from the mercury that's been leaching for years. And that's what I teach people how to do. I think it's really a crucial component to health, and not just like your gut health, but also your overall health, to just get mercury out of the body safely. So if you're interested in that, the Whole Health Blueprint application is always below. We would love to have you. Thank you so much for watching, and I'll see you guys in the next one. Bye.